Good afternoon, ladies and gentlemen. This is your host, Dr. Aftab Ahmad, with the program Innovative Pakistan with Dr. Aftab. And in our program, we discuss different topics related to health. We talk mainly about innovation and entrepreneurship in Pakistan. But we also have a keen interest in the health sector because that's like the situation is not very good. Overall, if we see, Pakistan is standing after 100 countries in health scenario, so there is a lot of room for improvement. There is a need for improvement. We have to improve the healthcare sector in Pakistan, and today is a very special day that we are going to discuss, and that day is World AIDS Day. So we are going to talk in detail about what is the situation of AIDS in Pakistan and also in the world. What is the recent research in this area, what are prevention measures, what are treatment options, and also what are the stigma associated with this disease. So all these topics we are going to discuss in detail, and we are really honored to have Professor Dr. Hasan Abbas Zaheer with us today in the studio. We are very much thankful to Professor Saab for sparing time for us for this today's very special program on AIDS, and he has a lot of expertise. He is serving as advisor to WHO at a very special position. He was also the head of Say Blood Transfusion Program in Pakistan, and he was also the national manager for National AIDS Control Program. So with lot of expertise in infectious diseases and also in AIDS, and currently he is also serving as a consultant for the AIDS control program. So with all these expertise, we have the very right guest to talk about this very important disease which is spreading in Pakistan. So we'll discuss that what is the current scenario in Pakistan, how we can prevent, what are the treatment options available, what is specifically AIDS control program of the government, and what are the challenges to that program, and why despite there is a decrease in the number of cases in the world in different countries, they have controlled the disease very much, but the situation in Pakistan is not that good because the number is increasing, unfortunately. Without further delay, once again we are thankful to Professor Hasan Abbas Zaheer for joining us in the studio, and let's start the discussion directly on the topic because Professor Saab, he was here in the studio several times. So last time we had a detailed discussion about his career journey, about his professional journey. So you can also get the details on our recorded program, but today we are specifically going to talk directly on the AIDS. So what is AIDS and why we celebrate this World AIDS Day, not only in Pakistan but also all over the world?
First of all, thank you very much for having me. Yes, indeed, today is December 1, World AIDS Day. And this is the only disease in the world which has a specific UN agency. There's no other disease in the world which has its own agency in the UN system.
Right.
So that's how serious this infection and this epidemic was. And it started in the 1980s, mid 1980s, early 1980s. And over the years, the epidemic has evolved all over the world. And in most parts of the world, it is now fairly well under control, and the policies and the strategies and the interventions that were adopted and designed and implemented have been successful. Unfortunately, that has not been the case in Pakistan, and Pakistan is among the countries where HIV is still spreading, and it's estimated about that every year we are having 48,000 new infections every year, in addition to the estimated cases, which are believed to be 370,000 in the country, out of which only about 86,000 have been diagnosed, and out of that, less than 60,000 are actually on treatment. So, not a very happy situation as far as HIV/AIDS is concerned.
So you have rightly said that in the world, if we talk about the disease is very much under control. There is they have done a lot of work on awareness. They have made the policies in which they have done the diagnosis and treatment And the scenario you have just mentioned, that in Pakistan every year we are adding around 48,000 cases, around 50,000 cases. That's a huge number, and this is a very serious kind of disease. So before going to detail in statistics and what is the scenario in the world, what is this disease itself? If you can since childhood we are listening about this disease, that this is a very serious kind of condition. Once you have this disease, it's a death sentence. So what is this AIDS?
Yes, AIDS is an infection of HIV virus,
Mm-hmm.
which is human immunodeficiency virus.
Right.
This virus, once it goes into a human body, it attacks the immunity system
Right.
of that person,
Mhm.
and gradually over a period of time, which may be months and years, it weakens the system. And once the system is sufficiently weakened,
Mhm.
then symptoms of the infection start coming up,
Right.
like repeated infections, chest infections, gastrointestinal infections, weight loss, and different kinds of symptoms. And most of the people are diagnosed only at this stage when their symptoms arise.
Right.
And by that time, the infection is fairly well advanced. But
Mhm.
as you mentioned, it was considered as a death sentence,
Mhm.
but now not the case anymore.
Right.
And now there are very good medicines
Mhm.
which are available in Pakistan, also free of cost,
Mhm.
from over 100 treatment centers that
Wow.
the government has established.
Mhm.
But unfortunately, the number of patients
Mhm.
diagnosed is very small,
Mhm.
and out of those, the number of patients getting this treatment is even smaller,
Mhm.
about 60,000. But those who are taking the treatment and taking it regularly, and it's a lifelong treatment.
Right.
So there's usually one medicine
Mhm.
a day, one tablet, and things like that. And so once you are adherent to the treatment, then the symptoms are under control. So
Mhm.
then it becomes like a chronic disorder,
Right.
like diabetes, hypertension, rheumatoid arthritis.
Mhm.
There's no cure for it,
Mhm.
but it can be managed.
Okay, excellent. So there is a good news for all the HIV patient, because in our earlier days there was like lot of awareness program on the TV and also on the radio about HIV, and it is usually said that it's a death sentence. But currently, as Dr. Hasan Abbas Zaheer, he has mentioned that now it's not anymore, because we have very advanced antiretroviral therapy. That is, if you are taking that therapy, you can very much control the virus, its replication, and we can also control the symptoms. But there is one concern, as you have just mentioned, that normally when the person is diagnosed, that's very late stage. So what is incubation period? So get the infection till the symptom appears. How much time it actually takes to get those symptoms?
It varies individual to individual, but usually it can take years
Mhm.
for the symptoms to come up. But quite a few cases are detected before that.
Right.
For example, if you go to donate blood,
Mhm.
all the blood banks screen for some infections, including HIV, so you can get detected there. Then in the diagnostic labs, people get themselves tested for HIV if you are undergoing an operation or dialysis or those kind of things.
Right.
So there's another opportunity to get diagnosed. And then people who intend to travel abroad for work purposes,
Mhm.
long-term work, so the immigration services also do their medical checkup, which also includes HIV screening. So there are different times that person is screened for HIV, and they become positive. They get detected, and then that's a very good opportunity to link them up with the treatment system,
Mhm.
put them on treatment, because now the new recommendations are that as soon as a person is diagnosed,
Right.
you put them on treatment. Earlier, it was not the case.
Mhm.
So linking up the diagnosed cases with the treatment component is very important, and the next step is to make sure that they adhere to the treatment and comply. It's a lifelong treatment,
Mhm.
so it has to be followed up properly.
Yes, that's very important. So we should like go for the, as Dr. Saab mentioned, that we should like, as you are diagnosed, you should go for the treatment, and this is how we can very much control the number of the viruses inside the body. So the next important thing is like that's also very important for our audience, is knowing that how the infection is spreading in Pakistan. As you have mentioned in the start that in several countries the number is in decline. This is also the statistics we are also following. But in Pakistan, the scenario is different. Even like we have seen recently, there are some sporadic kind of infection at some like areas. I have seen the case in close to Kot Mohammed. There is a village, and there were hundreds of people who were infected. And then there was recent incidents in Multan from a hospital that actually spread the infection. And in interior Sindh, we have several cases. So that's like we have two kind of scenarios. One is like in some cases they investigated and there are hundreds of patients at some places, and on the other side, in the general population, there are also chances that we can have this infection. So I think we should talk in detail, because that's very important for our audience to learn that how we can acquire actually this disease. So I will request Dr. Saab to please elaborate this one, that what are the most common ways of having this infection, and then also all the all the different ways in which one person can acquire HIV or AIDS.
Yes, the epidemic is evolving in Pakistan. Once upon a time, I used to be the national manager of the AIDS control program. This was from 2007 till 2010,
Right.
before devolution. And at that time, Pakistan had a concentrated epidemic, which means that the epidemic was largely restricted to specific high-risk groups, which included people who injected drugs,
Right.
commercial sex workers, transgenders, men having sex with men. So these kind of population used to have HIV cases, and very little cases in the general population. But now, after a gap of many years, I'm now again working in the HIV sector as a health consultant. And I've done some assignments for UNDP for the health sector, HIV sector, recently. And invariably, I compare and contrast the epidemic scenario in my earlier stint in the HIV sector with the current situation, and also how the program itself, the HIV program itself, has evolved from that time, which was before devolution of the health sector, and now that the health sector has devolved to the provinces. So now, in addition to HIV being present in these high-risk groups, and now the more concerning group is men having sex with men.
Right.
There's an alarming increase in the number of these young population. But in addition, even more alarming is the fact that we are now having cases in the general population.
Right.
And as you said, we keep hearing about reports of HIV outbreak in general population in places like Sargodha, Kot Momin, Kot Addu, Nawab Shah, Ladkana, Ratto Dero, Sargodha, you name it, it's popping up from all these places, and it's happening in the general population. And very sadly, most of the cases affected are children, even less than 5 years of age. And this is basically a reflection of the collapse of infection prevention control strategies, because the main culprit here for the general population infection cases is transfusion of contaminated blood and unsafe injection practices. And these are things that need to be, we need to devise new strategies and plans, because the current Pakistan AIDS strategy is still focused on the high-risk groups.
Right.
While the evidence on the ground, which is coming up in 7, 8, 9 last HIV outbreaks, is that the population affected is general population, including mostly children. So we need to revise and revisit our Pakistan AIDS strategy and cover the general population also. Basically, make a new strategy based on the evidence generated from the ground. And the evidence that is coming up is just the tip of the iceberg.
Right.
Most of the cases and outbreaks don't get to be reported in the media.
Right.
And unfortunately, the response of the authorities on the news of these outbreaks is to kill the report, kill the reporter, kill the channel, kill the
Right.
media. That is not a solution. You can't sweep the problem under the carpet.
Right.
You have to acknowledge that things are not good. And HIV spread is rampant. In fact, I would say it's kind of like a wildfire.
Right.
And we have already witnessed in the recent past how Pakistan has beaten Egypt and China and all the other countries and become number one in hepatitis C epidemic. I see a same pattern evolving in the HIV sector as well.
Right. So I think, as you have just mentioned, that there are several places in Pakistan where there was an outbreak. So I think there is also need to discuss these kind of cases, because as you has mentioned that there are several reports like Sargodha and Kot Mohammed and Kot Adu and Nawabshah and Sangad and many other places. So what do you think, why they must have investigated those cases, because this is very important for our society to understand that how the disease can spread and how the outbreak can happen in all these places. So they must have investigated. So what was the reason for these kind of outbreaks, so we can prevent these kind of outbreaks in our general population in the future?
As I said, there are two main culprits: contaminated transfusions and unsafe injection practices.
Right.
As far as transfusions are concerned, we have dual kind of blood transfusion system in the country. One is the new reformed system, which is functioning through the regional blood centers that we developed when I was leading the safe blood transfusion program.
Right.
And these are very well developed, advanced blood centers providing very good quality safe blood for transfusion. But at the same time, there exists the previous fragmented blood transfusion system where blood centers function in the public sector, private sector, NGOs, and many of these blood centers, especially the smaller centers in the rural areas, they are not very well managed.
Right.
And they are not very well regulated, and they follow unsafe practices, and their screening systems are very weak, and they are the real culprits in spreading HIV transmission through blood transfusion, also hepatitis C. And keep in mind that blood transfusion is the most efficient mechanism of spreading any infection which is transfusion transmissible. And unfortunately HIV is, hepatitis C is. And the next most important thing in the general population spread of HIV is the unsafe injection practices. For very strange reason, Pakistani population is very fond of getting themselves stuck with needles, and many of our fellow countrymen, they do not feel satisfied or they do not have confidence in their physician unless he puts a needle to fix them up very quickly, or even get themselves infused with a drip.
Right.
Unfortunately, the general practitioners and even in the hospitals and other health providers, they don't follow good injection safety practices, and sometimes, especially in the rural area, they open a disposable syringe in the morning and use it throughout the day on different patients.
Right.
And that's a very, very efficient way of spreading. If you have just one HIV case in your clinic and you use the syringe on that patient and then on the rest of the village, everyone will get infected, and that's what is happening.
So as Dr. Saab mentioned, that these are like the two leading ways, like one is the unsafe blood transfusion and the other is the the use of syringes or unsafe use of syringes. So this is very common. Like if I add my experience, since like I'm listening the presentation at different conferences, it is mentioned that Pakistan is at the top of using like the syringes and the injections. In this is a very common practice. So I think now we also raise the awareness in our community that this is not the way. You can also have the pills, and you can use those medicines orally to prevent like whatever the disease condition you have. So you are like most of the cases I know also the situation in like villages and remote areas, the people are not satisfied until they use the injections for them or they put them on the drip. And so this is how we can like you can acquire an infection, and if you acquire the infection, then that goes like you suffer for the whole life. This is like once you get that injection that is contaminated with either like HBV, HCV or HIV, because these are the blood-borne infection. So once you get that syringe, then you acquire the infection, and you suffer for the whole life. Not only you are suffering, but the whole family suffer. The economy of the country is suffering because you on one side you have like you can't work anymore, and on the other side we have to put like lot of effort for the treatment. So we have to understand this. This is very important that being Pakistanis, we should now understand that this is not good. That all the time we should go for the injection. So we'll continue on discussions. On one side, Dr. Saab mentioned that how we can prevent the infection. So I would just like to hear a little bit more about the role of these salons and barbershop. So what is their role in spread of infection? If like talking specifically on HIV, but we can also talk more about HBV and HCV because that's also a big concern in Pakistan, because we are for hepatitis we have one of the highest population in the world.
Yes, poor sterilization practices also lead to HIV infections, as for hepatitis B and C also. And where is sterilization required? It is required in the health sector, in the dentist clinic, in the surgical procedures, but also at the barbers shops and in saloons. And in all these places, the sterilization systems are usually not very satisfactory. One reason is just the huge patient load,
Right.
but the main reason I think is lack of awareness of the health providers, and also a state of apathy exists in the society. They just don't care.
Right.
And they're just after making more money and not really providing a good and safe service. But fixing these problems is not a rocket science. I mean, you have healthcare commissions in every province, and you have blood transfusion authorities in every province. So these are two regulatory authorities, and if they were doing their, they were discharging their responsibilities up to the mark, infection prevention and control would actually be under control. But that is not the case. So we need to focus on strengthening and holding accountable these two health regulatory authorities. And if you can fix the blood transfusion authorities and the healthcare providers, things should improve. Because we've had so many repeated outbreaks, and they have all been investigated, and the findings are the same in all the cases. And so the correction has to come from the regulators, and also capacity building of the health providers, and all these things that need to accompany strong regulation.
Right. So, as Dr. Hassan mentioned, that this is very important that the health regulatory bodies should be active, and so we can like prevent the new cases. So, like as he has just mentioned about the healthcare authorities, we have National AIDS Control Program in Pakistan. So, we wanted to listen from you that what is this program and how effective this program is before the devolution and afterwards. So, how effective it is right now? Is it like better, or should it be a federal program once again?
As in any other sector in the country, there is room for improvement, and this is an understatement.
Right.
There is loads of room for improvement. If I compare it with my earlier stint in the HIV sector, At that time, there was a federal health ministry which was in charge, and it used to work in coordination with the provinces,
Right.
and also in coordination with the international partners. So at that time, the National AIDS Control Program was a strong program,
Mm-hmm.
and it was supported by the World Bank. And if you are supported by the World Bank, all the other international donors also support you.
Right.
So it was a well supported, well funded, and well resourced program at that time. And the main responsibility for the national response was at the federal level,
Mm-hmm.
of course, in coordination and cooperation with the provinces. But then devolution happened, which actually didn't happen.
Mm-hmm. Right.
Because the idea was to devolve the health sector to the district level, to the local bodies level.
Mm-hmm.
Unfortunately, it just went from the federal level to the provincial level,
Mm-hmm.
and it didn't go further from the provinces to the district level and local bodies level. So that experiment was obviously not very successful. But the idea was not bad, but the strategy was bad. Maybe there was no strategy, and it was done in haste. But whatever the strategy, I mean, you can have a federal model or you can have an actually devolved model. Both are good options. But if you don't implement a good option, it becomes a bad option. But it's important that even if you have devolution like we have at the moment, the federal health ministry still has a very, very important role to play.
Mm-hmm.
It has to be responsible for policy making,
Right.
for data collection,
Mm-hmm.
for coordination with the provincial and regional partners, and for coordination with the international partners also, and also for data collection.
Mhm.
So all these roles were not being performed at the federal level
Mhm.
after devolution, because of the fact that the federal health ministry was abolished
Mhm.
one fine morning in 2011, June 30th. The ministry ceased to exist.
Right.
And so the role that the federal government should have played in all these fields, policy making, regulation, data collection, coordination, that was a gap. And so the whole health sector suffered as a result,
Right.
and the AIDS control program was not an exception. And the provinces took over their responsibilities, but in the absence of a centrally coordinating mechanism, the response was weakened.
Mhm.
And now the current situation is that the national response is not really the responsibility of the federal government. This role is now being performed, as far as the HIV sector is concerned, by the UNDP, which is a UN organization.
Right.
So the National AIDS Control Program became so weakened that this role has to be outsourced to a UN agency.
Mhm.
Hopefully, it will very, very soon come back to the government, and hopefully very soon the capacity of the national program will once again be built, and to enable it to perform its national role, and take up the challenge of controlling this wildfire of spread of the HIV epidemic in the country.
Right. So now I have like two more questions related to government. One is the funding situation. So one is like once there was a very huge funding for this program all over the world, and also in Pakistan, just like you have mentioned that the World Bank was also supporting this program. So what is the situation right now? Is it like coming to the federal? You have just mentioned that it's no more like in the federal, it's to the UNDP. So what is like the situation? Because funding is very important, especially countries like Pakistan. Whatever program we are running, just like we have the national initiative for HCV, Prime Minister initiative for HCV. So we have the funding for that. So we have international funding and the local funding. So overall, what is the funding now in Pakistan? And the other is like in so many countries, if we talk about, like I know the situation in US, once there was a huge epidemic of HIV there, but it's not anymore of concern in that country. In most of the European countries, I have like gone in some of the events and I have the discussion, and they are also not much that much concerned now, because they have a very effective program and it's running very well. If we talk even for the African countries, because after like US and Europe, the burden gradually increased in African countries, but even now in Africa, I was recently in meeting and they have mentioned that it's very effective program even in African countries. So a country like Pakistan, so if they have done a very good job, so what are the challenges, how we can make one of the things you have mentioned, that the regulatory bodies like the healthcare commission and safe blood transfusion programs and many other our national AIDS control program, they should be more effective. So what else we can do, because as you have mentioned that the cases are on the increase in Pakistan, and still we have like huge number, close to 400,000 cases, and only 60,000 people are on the, so there are so many silent infections that are present are. So that's also a side question to you as well, that what is our, is there is a national screening program, or we are just focusing on the old strategy is like to focus on those people who have at high risk of
See,
infection?
funding situation, first of all, it's not a very good situation.
Mm-hmm.
Until about 10, 12 years ago, we were dependent on the World Bank soft loan.
Right.
But in my last stint as the national manager of the AIDS control program, we won a very substantial grant from the Global Fund.
Mm-hmm.
It's a global organization called Global Fund Against TB, AIDS, Malaria. And so for the last 10 years or more, we are receiving Global Fund grants
Mm-hmm.
for HIV also. And very little local funding. But as you know, we are now witnessing shrinking of the international funding for
Right.
the health sector and all
Mhm.
the other sectors because of the new American policies.
Mhm.
So as a result, we will not be able to continue with the current situation anymore, because the international funding and global fund resources are shrinking, and they will not be able to provide us much support. And
Right.
this is very unfortunate, because we are still dependent on the international grants for health sector and especially for HIV. And the need of the hour is to become self-sufficient
Right.
and self-reliant, and
Mhm.
increase more fund allocation to tackle the HIV response in the country.
Mhm.
But the main, a very large component of the international funding is in the form of free medicines,
Right.
which are antiretroviral ARV medicines,
Mhm.
which are provided for managing the infected cases. And these are all medicines which are manufactured abroad,
Mhm.
and they are provided here and distributed free of cost, prescribed free of cost at the 100 plus treatment centers all over the country. So just imagine if foreign funding ceases
Mhm.
for HIV sector, that means we are getting no more free medicines.
Right.
So how will you treat what will happen to the cases? So what needs to be done is that we need to promote manufacturing of ARV medicines in the country,
Mhm.
just as we are doing for hepatitis C.
Right.
We are leaders in the world in hepatitis C infection,
Mhm.
and so what the international community did was that they provided Pakistan with waivers for the patents for the newly discovered HIV medicines, and now these medicines are being manufactured in Pakistan and provided to the patients.
Right.
The same thing we need to do for ARV medicines. So without wasting any more time,
Mhm.
we government should promote the manufacturing of these medicines in the country, and then even if the foreign donors cease to support the Pakistan HIV program,
Right.
we should be self-reliant
Mhm.
in managing our own patients. And for the rest of the interventions, like fixing the blood transfusion system, strengthening the healthcare commissions and other things. These are administrative measures, good
Right.
governance,
Mm-hmm.
good policy, good strategies. Again, no rocket science, but we need to come up with the indigenous solutions,
Mm-hmm.
and they would not even cost so much.
Right.
But we have to bring clarity. We have to review and revise our strategy. We
Mm-hmm.
are still stuck with the old strategy, which doesn't cover the new evidence of infection happening in the general population. So we need to wake up, basically.
Right. And the last thing about the screening program. So, what kind of screening program? And I also like wanted to know more about the diagnosis, how it is being diagnosed in Pakistan.
Yeah, well, this is a very, very important question, because there are many cases in the country which are being diagnosed every day,
Mm-hmm.
but they are not being reported to the AIDS program.
Right.
And these
Mm-hmm.
cases are being diagnosed in the blood banks. When
Mm-hmm.
you go for blood donation, they screen you for HIV. When you go abroad for work, they screen you for HIV and other things, and in the diagnostic sectors. But there is no linkage between the AIDS control program at the federal level or in the provinces with these respective organizations. Because if the AIDS program coordinate with the healthcare commission, then the diagnostic sector HIV cases will be picked up.
Mm-hmm.
If the AIDS program coordinates with the blood transfusion authorities,
Mm-hmm.
then the blood banking HIV infections will be picked up.
Right.
And if they coordinate with the immigration sector,
Mm-hmm.
so these are all low-hanging fruits.
Mm-hmm.
This is again no rocket science. You just have to sit down, make a clear plan and strategy, and coordinate with all these government agencies and get all these infections in your registry or database,
Mm-hmm.
and then make sure that these cases are put on treatment,
Mm-hmm.
lifelong treatment, and make sure that you retain all these cases in the in your treatment centers, and the target is to have as many cases as possible on treatment, so that their viral load in the
Mhm.
system becomes very low.
Right.
And if it becomes very low, then their immune system will not be affected,
Mhm.
and more importantly, they will not be able to spread infection from their body to anyone else.
Right.
So this is the general principle that we need to work on.
Mhm.
Unfortunately, we are not working on these lines currently.
Right. So this is very important, as Dr. mentioned, that we have to work. There are several ways in which we can know the right burden of the disease, and also we can put the patients on the treatment. So now coming towards like our society's issues, because there are a lot of stigma associated with disease. But before going to that, I think it's very important for our audience and also those who are watching our program online on FM 87.6 radio. It's live streamed there, so they can also watch this program. So I think, as you have mentioned, that there are around 100 centers in Pakistan. So how they are working? If somebody have a concern, they wanted to visit those centers. So where they are located? What kind of are they providing diagnosis, treatment? What kind of how they are working there, and how effective they could be?
They again loads of room for improvement.
Mhm.
Basically, you need to have very strong systems in place. At the federal level, you have to be very strong in coordination, in capacity building,
Right.
experience sharing,
Mhm.
and in addition to providing physical facilities in the hospitals where these treatment centers are present, and ensuring uninterrupted, constant supplies of medicines and other consumable items.
Right.
This is happening, but again, if the program at the federal level is weak,
Mhm.
all these things will suffer,
Right.
and they are actually suffering, and that is the reason why not enough people are on treatment. First of all, not enough people are being diagnosed, and
Mhm.
even those who are being diagnosed, not enough numbers are being on treatment. And even those who are on treatment, about 60,000 odd people, not all of them are compliant.
Right.
So there is room for improvement in strengthening the complete system. Basically, you need to improve governance. and make sure that you get more people in your database and registries so that they can be put on treatment, and then you need to make sure that they remain on treatment lifelong basis. But this is not happening at the moment, especially with children. They have additional issues like very poor nutritional status, very poor poverty indicators, and all these are contributing in the shape of very high mortality rate, especially in children who are infected. Again, this is not the case in other countries. In other countries, they have controlled all these things, but here these things are still out of control, and it's very unfortunate.
Okay, so there are centers, as Dr. Hassan mentioned, that there are centers who are working in Pakistan. They are providing. There is a lot of room for improvement, as he has mentioned, that we need to provide a constant supply of medicine and diagnostic kits, so they all the people who are at risk, they could be like diagnosed and they could be put on the treatment. Now coming towards the society, because time is also short, so we have to come up like we have to cover all the things. I think lastly, and also what are like it's very important to discuss. I think before going to like society, we can think about what are recent advancements in, as you have mentioned, one of the thing is a antiretroviral therapy that's available. So you have to take a pill a day, and you can very much control the disease, but you have to take it for the lifelong. So what are like any other treatment which is very much coming, like vaccine or anything which can improve the situation in the country or in the world?
Yeah, we are always looking for miracle cures. Miracles don't happen in real life. Of course, there's a lot of research going on, and vaccine production. If it materializes, that would be an excellent thing. But we have to be realistic, and generally at the global level, they've made very good progress in managing this disease, and especially one of the very good achievements has been almost a complete 100% elimination of mother-to-child transmission.
Right.
If the mother is infected, earlier invariably the child would also be infected.
Right.
But now there are medicine. If the mother is diagnosed, expecting mother is diagnosed with HIV, she can be put on treatment.
Right.
And if she is following the treatment properly, then there is 100% success rate in having a HIV negative newborn to a HIV positive mother.
Wow.
So this is a remarkable thing.
Excellent.
Unfortunately, it is not happening in Pakistan, and the reason again is poor governance. Because as I mentioned, there are 100 plus these treatment centers, HIV treatment centers in our different hospitals all over the country. But very few of them, I think 10, 20 maybe, have a mother and child center facility also. So in a hospital where adults are being treated, an expecting mother cannot be treated with ARV medicines. So we need to have treatment facilities for adults, children and neonates and expecting mothers in every one of these 100 plus treatment centers. This is not being covered in the country, and this it's again very sad, because in most of the cases the mother has HIV infection for no fault of her own. It's mostly her husband who acquired the infection somewhere abroad where he was working, and he got infected. And in those countries, they screen you regularly for HIV infections, and if you are found to be positive, they just deport you without really informing you also of many of these affected persons don't comprehend. They're not literate in many cases, so they don't understand what has happened to them or what is HIV, but they know that they have been infected and deported, but they come back. They don't inform their families, and the wife gets infected, and when the wife is expecting, the child would also get infected. So again, you need to have a good, strong, well-functioning AIDS control program at the federal and provincial level, and things can be fixed. You don't need too many resources for bringing clarity and good governance. Again, not happening at all.
So, Dr. Hassan mentioned that's very important that the governance should be improved because that's a very good way to control the disease in the country. I think, there is a lot of need of more discussion because we are running short of time. So, I just like wanted to ask at the end about like what we have seen in earlier days, like 30 years ago, there was like in TV channels, in news, we often like listen about the HIV awareness. So it was like everywhere in the newspaper, in the TV channels, in the radio programs. So everywhere there was a campaign to raise awareness about HIV in the country, and that was very effective. What I have felt at that time. So people were very much like concerned about the disease, but that's not anymore. What we have seen recently, I haven't like seen recently any like such campaign on TV or newspaper about HIV. So why that is the decline? Although we are like increasing the cases in our country, but the awareness is not up to that level. So how we can like once again raise the awareness at all the levels?
See, if the health program is weak,
Mm-hmm.
all the work that it's supposed to do will not get done.
Right.
And so the campaigns will also suffer.
Mhm.
But it's very good to raise awareness and sensitize people. But if you raise awareness and not do anything about the service delivery,
Right.
um,
What is the use of that?
yeah, I mean, you're just torturing the people. You're sensitizing them on the disease and its effects. If they have nowhere to go and the services are not good, that's not a very good situation. So you have to work on all the different aspects of the epidemic.
Right.
Of course, improve awareness, decrease stigma, but at the same time, detect more cases, make sure that they go on treatment, make sure that they are compliant, and make sure that the news of the outbreaks don't get killed.
Mhm.
That's the worst possible strategy. You
Right.
can't just hide behind a curtain. The problem will not go away
Right.
unless you address it scientifically.
Yes, you have rightly said. So, in like, I know one of the scenario in which that happened in Punjab. So there was one person who came from abroad, and he was suffering from the disease. And when they have done the diagnosis, I think there were 270 cases of HIV in that community. So you can imagine that if one person with the disease can spread the infection to so many people. So if like there is an outbreak, if now there are 270 people, to how much number they can spread the infection. So this is a real challenge for Pakistan. So we have discussed in detail that what are challenges in Pakistan, and the solution, as Dr. Hasan Abbas Zaheer mentioned, that is very important. We have to work very carefully about this matter, especially our healthcare commission, our ministries. They should be active, and this is how we can control the disease in the country. So at the end, we would like to ask from Professor Hasan Abbas Zaheer, what is your message on World's AIDS Day? Because you are in the studio, so we will be very happy that if you would like to share your message to our community about this special day.
I would, of course, my message to the general population is to adopt a healthy lifestyle. But many people are getting infected without any fault of theirs. So it's really the message should be for the policymakers.
Right.
They need to wake up and come out of the denial phase. In fact, I don't even call it denial. It's apathy phase.
Right.
We have to come out of apathy phase and face this real challenge in a good scientific manner, adopting good practices and good governance, and we should appoint the leadership of the program and also the staff on merit,
Right.
and give them sufficient time frame to perform on ground, and then hold them accountable, of course. But it has to be merit-based appointments of fixed tenure. That
Right.
is absolutely essential. Again, this is not the case at the moment. There are very too many frequent changes in the program leadership, and even those are not on merit. So that's also another factor which is fueling the epidemic in the country.
So thank you very much, Professor Hasan Abbas Zaheer, for joining us today in the studio of FM 87.6. And we have a very special program and a very special discussion with reference to World AIDS Day. As per our discussion and as per the expertise of Professor Hasan Abbas Zaheer, this is like the situation is very bad in our country, unfortunately, because the number of cases are on the increase. But this can be done. The problem can be solved if the policymaker they make an effective program of controlling this disease. They can like have a visionary and true merit-based leadership of National AIDS Control Program, and this is how we can very much control the disease. So with this, once again, we are thankful to Professor Hasan Abbas Zaheer for sparing time for us in the studio, and we will inshallah invite him for other because he has very good expertise on infectious diseases, so we'll call him again on some specific day. Thank you very much once
Always
again.
a pleasure. Thank you.